If you or a loved one is living with cancer, you probably have two focal points: how to rid yourself of it and how to prevent it from coming back. You'll get some terrific information today on Cancer Concepts and Complements with Dr. James Belanger. We'll explore natural medicines which may enhance conventional therapies, share cutting-edge research, and offer insight on how diet and natural medicines can play an important role in treating and preventing cancer. The information presented herein is in no way intended as a substitute for medical counseling. Now, here is Dr. James Belanger.
Hello, everyone. Welcome to Cancer Concepts and Complements. I'm your host, Dr. James Belanger from the Lexington Natural Health Center. Last week, I was talking about hormone-resistant prostate cancer. They also call it castration-resistant prostate cancer. Prostate cancer that no longer responds to hormone-lowering therapy or testosterone-lowering therapy. And I was talking about the mechanisms of how that cancer becomes resistant to the hormonal therapies and some natural medicines that might stop some of those resistant mechanisms, allowing the hormone therapies to work better and longer. And so I'm going to continue that discussion today because there's still a lot more to talk about. Unfortunately, yes, metastatic prostate cancer or hormone-resistant prostate cancer right now is incurable, so a lot more research needs to be dedicated to this. I'm going to review what research that has been done so far, some really promising natural things. But anybody listening that has a lot of money, please sink some money into natural medicine research. There's some very promising things being studied, but in order to get them more widely accepted, more money needs to be spent, more larger trials need to be done. And it's, if you've been listening to a lot of my shows, it's not as simple as just, change your diet, eat some soybean or something like that, or take a pill and your cancer goes away. It's numerous things that have to be addressed. Some people call it the terrain. The terrain needs to be addressed. You want to change the environment that is surrounding the cancer, changing your body to make it an uninhospitable environment for cancer. And that involves numerous dietary changes and possibly taking certain nutritional supplements that are derived from foods, from green tea and pomegranate we were talking about, and omega-3 fatty acids and this and that. And then using the laboratory to help guide progress. A lot of the current laboratory tests now for monitoring prostate cancer is simply, the PSA. That's the main thing. Sometimes doctors will do bone studies and blood levels to check bone markers. But there's all kinds of other things that can be tested that influence the growth of prostate cancer. I'm going to talk about some more of those today, like insulin growth factors and fibroblastic growth factors and all kinds of things. And these can be monitored. And if a lot of these things are abnormal in the system, elevated in the blood, they can cause the prostate cancer to progress more. If you monitor them and use them to help guide you to construct a treatment plan that takes away a lot of these things that feed the prostate cancer, then you're more likely to halt it. But it's not as simple as, just take a couple pills and the cancer goes away. It's a complex multitude of factors. So Lupron and Casodex is the main treatment for prostate cancer, a metastatic prostate cancer. And those are drugs that affect testosterone levels and the binding of testosterone to prostate cancer cells. But they only work for about 2 to 3 years. And then there's a couple new drugs that have come out that have helped prolong that survival, another 2 or so years. And they include, I mentioned these last week, Xtandi and Zytiga. And then there's another drug that also works, but it doesn't work on affecting testosterone. It affects some other growth factors that influence prostate cancer called c-MET or HGF and VEGF, and it's called cabozantinib. And that has helped, prolong survival as well. Patients have some improvement for about 12 weeks or something like that, and then it can start to progress. So that's a new drug that has come out. But there's a whole host of other growth factors that influence the cancer. And so I was giving you an analogy last week to think about prostate cancer, as like a factory. And I gave you an example of a factory that makes chicken broth. And there's a lot of things that go into chicken broth. There is chicken. There's onions and carrots and celery and spices and things like that. So think of the chicken as the hormone, the testosterone coming into the prostate cancer, and it uses it to help grow. So the chicken broth company needs a lot of chickens to make their chicken broth. But there's other things coming into the factory as well that lead to the end product of the chicken broth, and those are those other ingredients. Well, there are these other ingredients that come into the prostate cancer that help it grow, and those include insulin-like growth factor called IGF, GF for growth factor. Then there is epidermal growth factor, or EGF. Then there's HGF, hepatocyte growth factor. Then there's FGF, fibroblastic growth factor. Then there is VEGF, vascular endothelial growth factor. And there is TGF, transforming growth factor. So there's a lot of other ingredients, should we say, coming into the prostate cancer that can help it grow too. And you take away a lot of the testosterone, so you take away the chicken from the chicken broth company, they'll just break up all the other things to help with the chicken broth. And then I talked about adding additives and things to enhance the flavor if there's not as much chicken coming in. And that's what cancer cells do, is as you deprive them of their necessary ingredient, testosterone, and you are blocking the testosterone receptors in the prostate cancer, then it simply just starts to eat some other things, these other things I just mentioned. And that's where this cabozantinib comes into play. It affects the c-Met, or the HGF, and then the VEGF, but it doesn't affect IGF, it doesn't affect EGF, it doesn't affect FGF, and other growth factor pathways. And currently there aren't any medicines that affect those other growth factor pathways, and that's the reason why this cabozantinib doesn't work for long. Then you add some things to it, and there's natural medicines that can touch on these things that might help also help people with prostate cancer survive longer. These pathways, once these growth factors bind to the prostate cancer cell, it's like them going down an assembly line I talked about. And so they go down these assembly lines, and then they eventually reach the pot where the chicken broth is made. So what happens is these growth factors come in to the cancer, and they go down this assembly line, and then the pot is analogous to the DNA of the prostate cancer. They bind to the prostate cancer DNA, and that stimulates growth of the prostate cancer. And there's a series of steps as it goes down the assembly line, and they have all these different names, PI3K and AKT and all that kind of stuff. And sometimes what happens is prostate cancers, if you block the growth factor receptor, the binding site of where the growth factor comes in, it just upregulates downstream pathways. And this is where the natural medicines also come into play, because they can inhibit some of these downstream pathways. At least that's what a lot of the animal studies are showing. So it's like, back to that analogy of something coming into the factory, here opens the garage doors of the factory and in come these ingredients. All right, well, the garage doors are closed, but the assembly line's still running, and other things are coming in. The company's making things independent of the deliveries to help keep the assembly line flowing, to keep the chicken broth coming. Okay, so let's start with the first of these growth factors, is insulin growth factor. I touched on this a little bit last week when I was talking about flaxseed and its potential to affect insulin growth factor pathways in prostate cancer. But first, we can measure this in the laboratory. You can determine, is this going on in a patient with metastatic prostate cancer, or even better, checking it before a patient becomes resistant to the hormone therapies, because it might work better if you start it before there's resistance developing. So there's been research done in the journal Prostate in a new study, 2014, at Dana-Farber right here in Boston, where they measured IGF binding protein 1 in the blood. So IGF circulates in the blood. It's made in the body and circulates in the blood, and it starts to travel like on a road towards the prostate cancer. And IGF BP1 helps increase the availability of the IGF to the prostate cancer. So it's kind of like a set of hands that the prostate cancer uses to grab the IGF out of the blood and pull it in. And so they've studied at Dana-Farber measuring this thing in the blood and correlating with prostate cancer resistance, and found that the men had shorter survival times when they had higher levels of this binding protein. That the median time for overall survival was 32 months in patients that had the higher level of this IGF versus 48 months survival in those that had low levels. So it's a simple test to measure. It can be measured at labs like LabCorp, and you want to make sure you do things to lower that so the cancer can't grab a hold of that IGF and pull it in. And there are some natural things which I'm going to talk about. Besides measuring IGF binding protein number 1, you can measure IGF itself in the blood and the car, I call it, that transports it around in the blood. It's transported around in the blood by something called IGF binding protein number 3, IGF-BP3. And so there's research showing where you measure IGF, the thing that feeds the prostate cancer, and its truck that carts it around, IGF binding protein, and you measure those two things and you form a ratio. And those patients that have a high ratio are more likely to have progressive disease. That was studied in Cancer Causes Control 2012. So if you think about IGF is floating around on this truck, and then it has to get off the truck, the IGF binding protein 3, and then go into the prostate cancer cell factory and then do its thing. It has to get off the truck, though. And so if there's more trucks binding it, then it can't really get off and do it as much. So that's what the ratio comes into play, is you measure the ratio, and if it's high, that means that there's more of the IGF than enough trucks to carry it around, and then it's more likely to be in a free state, freely floating state, to enter the prostate cancer cell. And some of the natural medicines can help increase the binding protein, the IGF binding protein 3, grabbing a hold of the IGF so it can't get off and go influence the prostate cancer. So we're going to talk about that. So those are some things that can be measured, and then you can monitor to see, if a patient has a high level of IGF binding protein 1 or a high ratio of IGF-1 to IGF binding protein 3, then they might qualify for some flaxseed, or we're going to talk about lycopene and things in celery and parsley called apigenin and this and that, and monitor them. And if it goes down, if these levels decline, the research shows that can lead to a better prognosis, because it's a growth factor. You just took that thing away from the prostate cancer, just like the hormone therapies are taking the testosterone away. Keep on starving the cancer of all the things that it likes, and using the lab to help determine that you're doing that successfully, and checking PSA along the way as well. So yes, flaxseed has been shown to affect IGF binding protein 3 and the ratios there. And there's a study done in the Journal of Medicinal Foods 2013 where they measured this compound that is derived from flaxseed. I talked about this when I was talking about breast cancer, that when flaxseed goes into the gut, the healthy bacteria break the flaxseed down into something called enterolactones and enterolignans. They're breakdown products of the fiber of flaxseed formed by the healthy bacteria. Then that stuff gets absorbed into the bloodstream and affects the insulin growth factor pathway. So in this particular study, they took 147 men with prostate cancer before they had surgery. This is an early stage prostate cancer study, but they did it before they had surgery. And they measured, and they gave them about 30 grams of flaxseed, which is like 3 heaping tablespoons of ground flaxseed, for about 30 days before they did the surgery. And then they measured the urine levels of these enterolactones as a way to guide that the patient really did what, took it, and how much they formed in their gut. And they found that those that had high levels of these enterolactones, the prostate cancer had less proliferation markers. So the cancer wasn't growing as rapidly as the men that had lower levels of enteral lactones. So it's another thing to measure. It can be measured in the urine and to help guide that the person is converting the flax seeds and forming enough enteral lactones. And it might affect this insulin growth factor pathway. So that's another thing that can be measured to determine that the flaxseed is having some kind of pharmacological effect in the body. Low carbohydrate diets. There's been some studies, some mixed studies on this, but it certainly can't hurt. There's definitely no harm in doing it, and it might benefit is reducing the amount of carbohydrates in your diet. Carbohydrates, a lot of people know, raise insulin, and it raises also insulin-like growth factor in the body, and that might influence the prostate cancer. So especially in men that have high levels of this IGF binding protein 3 ratio, a lower carbohydrate diet might be useful. And then you can use that test to monitor that they're following the diet well. So carbohydrates, I'm talking about, especially white flour, white rice, breads, white pastas, fruit juice, sugar, of course, anything that tastes sweet, maple syrup, honeys, all that kind of stuff. And then, even some whole grains, like rice, for example, brown rice, it certainly has more fiber than white rice, but it still has a lot of starch in it. So my advice to people is to eat lots of green vegetables and different colored vegetables. Get a wide variety of vegetables, but especially those green vegetables and the cruciferous, which we're going to talk about, the cabbage and broccoli, the Brussels sprouts. Nuts and seeds, but especially flax seeds and walnuts and hemp seeds. And then get your carbohydrates from things like beans, black beans and lentils and kidney beans, because they have carbohydrates, but they have protein and they have lots of fiber. And the fiber slows the absorption of the starch that's found in the beans. So it doesn't raise the insulin levels as much as something that has no fiber, like white flour or white rice or fruit juices and stuff like that. And then eat small amounts of some protein and good quality animal protein. Wild caught fishes, the fatty fishes like salmon and sardines and anchovies and mackerel and those types of things. And then I'm not opposed to good quality meats, grass-fed meats that are cooked medium rare, so you don't get a lot of the blackened marks and stuff on it. And from grass-fed, 100% grass-fed cows. If you look those up, they actually have high levels of omega-3s because grass has omega-3s. And if the cow is eating grass, then it will have a lot of omega-3s. And so that's kind of the basic diet. So you start your morning off with like a smoothie is good, but you put like a nut milk in there that has no sugar in it, and you throw in a bunch of green vegetables in it, and you throw a little avocado. Sounds gross so far, but then you put the fruit in there. You get your berries. Berries have a lot of anti-cancer properties. And then the highest fiber of all the fruits. Raspberries have the most fiber of any fruit, and blackberries. And then blueberries are very good, and strawberries too. And they have those bioflavonoids that inhibit the cancer. And you can put a little protein powder in there if you want. And then you just blend that all up. And now you got like a nutrient-dense anti-cancer shake there with not a lot of sugars in it, but a lot of fiber and healthy fats. And you can throw some flaxseed in there as well. Or you do some poached eggs from good quality pasture-raised eggs where the chickens are roaming free, eating what's their natural diet and not being fed corn. And you cook them so they're poached. Don't overcooking the yolk. And then the yolk has all those beta-carotenes and carotenoids and the omega-3s in it. And you serve that on a bed of sautéed greens, kale and the collard greens. And now you got this anti-cancer breakfast instead of a bagel, which could jack up your insulin, and a pastry and sweet cereals and pancakes and syrup and all that high carby breakfasts can raise the insulin and might stimulate prostate cancer. And then for lunches and dinners, you eat salads and vegetable soups with all kinds of vegetables and less on the grains. Throw some beans in the soups. Throw some beans in your salads, and some salmon in the salad, and some walnuts in there, and flaxseed oil. And now you get, again, another very good anti-cancer lunch instead of sandwich on white bread with iceberg lettuce or something like that. And then for dinners, focus on fish, maybe some good quality grass-fed meat, or go vegetarian and have some beans and lots of vegetables and just a little bit of the grain, not a lot of the grain. The grains really don't have a lot of anti-cancer properties, unless I've seen some research on black rice has some anti-cancer properties because of the pigments in there. But most of the anti-cancer compounds are coming from everything but the grains. And so you want to focus on especially those green vegetables, and you can have some beans and stuff like that on the side. So that's appears from the research to be the best type of diet. Okay, we're going to take a break, and we're going to talk about more things that affect the insulin growth factor pathways. This is Cancer Concepts and Compliments.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hi, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, I was talking about how insulin growth factor can help stimulate the growth of prostate cancer, and it gets upregulated in men that are starting to become resistant to the hormonal therapies. And that's another way that prostate cancer can start to grow. And there aren't any current treatments right now that reduce that growth factor pathway, that starve the cancer of that insulin growth factor. But there are some natural things that are looking promising, and there's lab tests that can be done to determine if that is going on in a man with prostate cancer, see if the insulin growth factor pathway is being upregulated, and then you can use that to guide you that you are on the right path. But flaxseed is one thing that might decrease that, and watching the carbohydrates in your diet, eating more vegetables and nuts and seeds and beans and in small amounts of some good quality animal protein. Lycopene is another thing in food that has been shown to inhibit the insulin growth factor pathway, and a lot of men are aware of that. Now, certainly lycopene by itself is not going to be a cure for prostate cancer. I don't think there's going to be any one thing in and of itself that just takes care of the whole disease. It's all about affecting the terrain and treating the whole body and all these different pathways. If you look at it that way, then you're more successful. Well, lycopene does affect the insulin growth factor pathway, but it doesn't affect other pathways that can get upregulated, and so it doesn't lead to a great effect on its own. But there's been some research showing that it inhibits the binding of the insulin growth factor to its insulin growth factor receptor in prostate cancer cells. And there's been a study done in the journal Neoplasia in 2011, the University of California, where they took mice that were resistant to the hormone-lowering therapies, and they gave them chemotherapy. The Taxotere chemotherapy is often used in men with prostate cancer, but it only works for a few months. But they added lycopene to that, and they found that it had an increased effectiveness, 38% increase in effectiveness, and it's worked by affecting the insulin growth factor pathway, which can lead to resistance to Taxotere. So it's another thing, and it's found, if you haven't heard it, in tomatoes. Tomatoes are the richest source of lycopene, much higher than anything else, but it is found in watermelon, but I wouldn't be eating a lot of watermelon because of all the sugar. And it's goji berries and things like that. But tomatoes is the real main source of it. And cooked tomato products, because they are, it takes a lot of tomatoes to make some tomato sauce and tomato paste, are the richest sources. And heating the tomatoes breaks down the cell walls and allowing the lycopene to come out more. So a scoop of tomato paste is the best way to get a rich source of lycopene besides taking a pill. And you do want to take it with some fat. You can't absorb lycopene without fat. And so, traditionally tomato sauce will have some olive oil or something in there. But you can flax oil mixed with the tomato paste as a great way to absorb the lycopene from the tomato paste and get it that way. And monitor IGF. levels in those ratios and see how it affects it. But it does also affect the binding, and unfortunately you can't measure that. It affects the binding of the insulin growth factor, according to this study in mice. There's something else found in other foods, found in parsley, found in celery, found in artichokes, and it's called apigenin. Apigenin, A-P-I-G-E-N-I-N. Study done in pharmaceutical research in 2012. They gave mice with prostate cancer different dosages of this apigenin in very small amounts that you could get probably in a good handful of fresh parsley if you ate that every day. Parsley is the richest source. But they gave just the apigenin by itself and found that there's a substantial reduction in IGF in the blood, and IGF, the binding protein, increased. So it grabbed a hold of the IGF in the blood, keeping it away from the prostate cancer. And after 8 weeks, it inhibited the growth of the prostate cancer by 59%. So it's something that also has potential. It does come in pills as well, but start eating more parsley, fresh parsley, throwing that in salads and throwing it in a soup or something like that after it's cooked as a garnish, or even making a pesto out of parsley instead of necessarily basil and using that on things. So putting that on eggs, for example, would be great, or an omelet cooked, stuffed with parsley. And then artichokes and stuff like that are great. Okay, other things that affect this IGF is milk thistle. Milk thistle is a plant, and it has these spikes all over it, so if you step on it, you're going to really hurt your feet. And it has these seeds in it. And traditionally, a lot of people hear about milk thistle is good for the liver. They've studied it for viral hepatitis, showing that it can help the liver repair itself from damage from that virus. But it's also been studied a lot with prostate cancer, in part because it affects that insulin growth factor pathway. And same thing like the apigenin, it's been found to increase IGF binding protein in the blood of mice. So it grabs a hold of that insulin growth factor and makes it unavailable for the prostate cancer, or less available for the prostate cancer. And so they did this study in Cancer Research 2002. They feed mice with prostate cancer different dosages of this compound found in milk thistle called salibenin. It's found in milk thistle seeds. And after 63 days, the tumor volume was reduced by 53 to 64%. And its mechanism was affecting insulin growth factor. So it's another thing that could be potentially used, especially in men that have high levels of these insulin growth factors in their blood. What's also interesting is the milk thistle affects TGF. So I was talking about last week, TGF is another growth factor, transforming growth factor, that helps lead to androgen resistance by upregulating this enzyme that helps the prostate cancer make testosterone out of testosterone precursors. The adrenal gland releases these compounds called androgens like DHEA and androstenedione, and they travel through the blood, and the prostate cancer cells uptake them and convert them into testosterone right there at the site of the prostate cancer. So they don't need the testosterone from the blood directly from the testicles. And that's a way they upregulate it, and they use TGF as part of that. So you can measure TGF in the blood of men with prostate cancer, and if it's elevated, it's considered a negative prognostic indicator. So you can do things to lower that. And I talked about different things last week from neem extract and stuff that have been shown to affect that. But milk thistle is another one that prevents the cells that surround the cancer from making the TGF and allowing them to become resistant to hormone therapies. There are different compounds in milk thistle. Salibenin is one of them. But there's also something called isosalibin. They're found in extracts of the seeds of milk thistle. Well, they found that isosalibin is more powerful than salibenin, so that might be a better choice to study in more human studies. There is a human study in men, and it was just a phase 1 just to see how well it was tolerated. And it was tolerated fine, and they gave massive doses of it. But again, one thing all by itself is not going to be be often effective enough. And if insulin growth factor doesn't seem to be upregulated in a particular man with prostate cancer, then milk thistle might not be effective. So it's like you can use the labs to help pre-select what are the most important things to do and focus on, than just trying all kinds of different things all at once without any guides. Boron is a mineral. Boron is a mineral. It's found in foods. It's actually found in fruits. Fruits aren't high in too many things, but they do happen to have this mineral boron, and it's found in apples, for example. In plums have rich sources of boron, but it's also found in almonds. And so they've studied boron in different journals, but Toxicologic Pathology 2004, they gave mice prostate cancer, and they measured the tumor sizes after giving them a control diet or giving them a diet that contained boric acid, which is a form of boron. And they checked the measurements of the tumors, and they have reduced in growth by 38% in the group that had the low dose of the boric acid, and then measured PSA, and it decreased. And the way it worked was it affected IGF. That when they measured the actual level of IGF binding to prostate cancer cells and found that it was markedly reduced. So boron is another mineral, and you will often see that in a lot of it's often given in a lot of the benign prostate products too. Boron is effective for that. So, or eating more of those foods, but not the really sweet apples. Eating more of a Granny Smith apple, organic Granny Smith apples. Unfortunately, have been bred for more sweeter and sweeter varieties, like the Golden Delicious apple and the Fuji apple, and those don't have as many phytochemicals and anti-cancer compounds, and so they don't keep the doctor away, like the old saying goes. The more tart varieties are the better ones to have, and getting harder and harder to find in supermarkets too. So stay away from the sweeter apples, not so good. Green tea, last thing that I'll talk about when it comes to the insulin growth factor. Green tea has also been shown to substantially reduce levels of IGF, and they've done studies in the journal Cancer Research in 2004 at the University of Wisconsin, showing that green tea can inhibit the growth of prostate cancer by affecting IGF. And also, importantly, it affects some of those downstream pathways. Sometimes, like I said, the prostate cancer says, okay, you're taking away my IGF from me or my other growth factors. Forget it. I won't even bother using it. I'll just go downstream from it and use things, upregulate things downstream from it. So it's, again, closing the garage door in the factory and saying, okay, you're not going to bring me my onions and my carrots anymore. I'm going to just grow them right here on site and go downstream, should we say, and throw them on the assembly line myself instead of having you deliver to them and bring them to the assembly line for me. And so if IGF is being taken away from the cancer by low-carb diets and flax seeds and all these different things like that, then the cancer upregulates downstream pathways, which include this thing called PI3K and AKT and stuff like that. And green tea affects some of those downstream pathways as well. Those, unfortunately, can't be measured in any way to see, in blood tests, that is. But in the animal studies, they have, tested that and found that it does affect some of these downstream pathways. So something that needs, again, more research. But green tea is not going to hurt. There is some, talk about green tea affecting liver enzymes. I've really never seen that. I think some of it has to do with the particular extracts. When companies produce these extracts, sometimes solvents are left behind, and maybe the solvent, some contaminant has affected that. But it has been reported that green tea extracts, concentrates, might raise people's liver enzymes, something that should be monitored. But I've not seen it, and I think it depends on the particular product. There's research showing that green tea might work better when it's combined with something I mentioned last week, quercetin, Quercetin. Quercetin is that compound, the bioflavonoid, that is found in apples, like the green apples there, and it's also found richly in and yellow onions. Onions are a rich source. Well, in this study done in Journal of Nutritional Biochemistry in 2014, they combined green tea with quercetin and noticed much better decrease in tumor growth after 6 weeks. It was 21% in the green tea. It inhibited tumor growth by 21% versus 45% in the quercetin plus green tea. And how does the quercetin work? It also affects those downstream pathways. So it kind of decreases those. And so the two together have a synergistic effect. So certainly those could be added to the diet, drinking more green tea and eating more yellow onions. You want the pungent onions. The white onions, again, onions are something that have been altered a lot. They're making them sweeter and less pungent, and those don't tend to have as many of the anti-cancer compounds. Yellow onions, the more pungent varieties would be better than the sweeter white onions to get you your quercetin. And then green tea, you want to be drinking that all day long. And you can get decaf. It's not the caffeine that has its anti-cancer effects. It's this compound in green tea called EGCG. And you can drink that, or that comes in pills. They certainly have green tea pills. And it does appear that the more green tea, the better. So that's the convenience of the pills. And they also have quercetin pills, too. And they have different versions of quercetin that are more absorbable than others. Quercetin does affect some other growth factor pathways in prostate cancer. There's one called the interleukin-8 pathway, and you can measure that in the blood as well. And there's research showing when interleukin-8 is high, cancer is more likely to spread to the bones and causing breakdown of the bones and spreading. So you can check interleukin-8 if it's elevated. Quercetin is something that helps lower that. Okay, so when I get back from the break, I'm going to talk about some other growth factor pathways. One's called HGF, hepatocyte growth factor, and then FGF, fibroblastic growth factor. This is Cancer Concepts and Compliments. I'm Dr. James Belanger.
This is Cancer Concepts and Compliments with Dr. James Belanger. The information presented herein is in no way intended as a substitute for medical counseling. If you would like to find out more about the Lexington Natural Health Center, please visit lexingtonnaturalhealth.com. That's lexingtonnaturalhealth.com. Now, back to this week's program.
Hello, everyone. Welcome back to Cancer Concepts and Compliments. I'm your host, Dr. James Belanger. Before the break, I was talking about the insulin growth factor pathway and how it influences growth of prostate cancer. Now I'm going to talk about a few other growth factors. The next one is called hepatocyte growth factor, or HGF. HGF is another growth factor made in the body, and it's traveling along in the blood, and then it reaches the prostate cancer, and the prostate grabs it and uses it for fuel, like food, to help it grow in response to less testosterone. So it's a way it can grow without using testosterone. And it binds to this receptor called the c-Met receptor. And so it's like an assembly line, and it binds to the DNA and stimulates the growth. Well, so you can measure HGF in the blood, and they found that men that have metastatic prostate cancer are more likely to have higher levels of HGF. So it's not something you want to see happen, so you can monitor it and use natural things that lower it. There is a drug that affects HGF that is approved, but it's only approved once men become resistant to a lot of these hormone-affecting drugs. When they become resistant for Xtandi, and when they become resistant to Zytiga, and they develop, bone disease and stuff too. So that's not something we want to see happen before you end up getting this drug approved. There's this drug called cabozantinib that can be used, and it affects the c-Met pathway too. But it's associated with some side effects, gastrointestinal-related side effects, nausea, vomiting, upset stomachs, that kind of thing. There are natural things that have shown activity against this that are a lot better tolerated, but not as well studied. Somebody needs to put some more money into this and find out if this could be a better alternative than the current drug. And then these things are available. You can start them before becoming resistant and developing a lot of bone disease as well. And you can use this HGF blood test to see how you're doing. So you can measure that, and then see. What affects it is green tea. We just talked about green tea affecting IGF. Well, there's been research study in men with prostate cancer showing that EGCG, the compound that's found in green tea, can reduce HGF. So a study was done in Cancer Prevention Research in Louisiana in 2009, 26 men that had prostate cancer positive biopsies, and they were scheduled to have their prostates removed. They gave them a large dose of this EGCG, 800 milligrams, which would be a lot of green tea, but they gave it in a pill form. And then they measured HGF, and they noticed significant reductions in HGF. Again, it was an early study done before it had spread, but it has been studied to target that. So it's something that can be measured in men with different stages and used especially for men that are having a slightly elevated HGF to knock that down before it leads to too much growth in the prostate cancer. Another thing that affects HGF is resveratrol. And I've talked a lot about resveratrol. It's found in grapes and stuff and red wine. But there's something that might work better than resveratrol. It's similar to resveratrol in structure called pterostilbene. And it's actually spelled with a P, so Ptero, stilbene. And it's a natural compound found in berries, blueberries, So that's why you have those berry smoothies, getting that and your cruciferous vegetables in there and your hemp milk, and you're going to get a lot of anti-cancer properties. But pterostilbene has been shown to help, inhibit the growth of prostate cancer. And they did a study at the University of Mississippi where they gave, those mice prostate cancer, and it hardly grew at all after 8 weeks in the pterostilbene group, but it grew like 3 to 4 times the size after 8 weeks in the control group. So it's another thing that might affect the HGF signaling system and be used to help lower that. You measure it. If it's high, green tea, pterostilbene, maybe resveratrol, those types of things could be used. Besides HGF, there's another growth factor that can influence prostate cancer. It's EGF, epidermal growth factor. Now, you can measure that, but I haven't really seen any studies showing that is associated with any prognosis or, it's really been studied. They really haven't done many research studies measuring EGF in the blood. It can be done, but it's not necessary. It's just having certain things in the diet that affect that. And the main thing that has been shown to affect EGF signaling in prostate cancer are soy foods. And it's been found that men in Japan that eat soy have a lower incidence of prostate cancer. And there has been some studies done in rats where they gave them something found in soy called genistein, and they measured EGF, epidermal growth factor receptors, and then another receptor that's similar to the EGF receptor called the HER2 receptor, which we talked about in breast cancer, showing that when the mice ate a diet that was high in soy, it downregulated the expression of these receptors in the prostate cancer by over 50%. So it takes away the binding sites in the prostate cancer for this growth factor that helps influence it. Again, soy by itself is not going to be any kind of cure because it doesn't affect a lot of other growth factor pathways, but it does seem to affect this EGF pathway, and it's certainly not going to hurt to eat some soy foods unless you're allergic to it or something like that. It might be better to eat the fermented soys because the genistein, this compound that's found in soy, is better absorbed when the soy has been fermented, broken down by bacterial or fungi fermentation to a more absorbable form. Because if it's not in a fermented form, like if it's in the form of soy milk or tofu, our gut bacteria has to break it down to help it get absorbed better. If it's in the form of miso, fermented soybean, or tempeh, something like that, it's already in its absorbable form and can actually get absorbed right in the stomach wall. There's been some studies done in men with prostate cancer, and one of the studies was done in hormone-resistant or castration-resistant prostate cancer, showing that soy slows the increase of the PSA compared to the control group. So it doesn't stop the growth of the prostate cancer, but it appears to slow it down compared to men that didn't have any soy. So another useful thing to add in the whole collection of things to do to help keep this prostate cancer at bay. Another thing that affects EGF is melatonin. And I talked about this with the breast cancer because melatonin affects EGF and breast cancer as well. But there's a study done in the journal Prostate 2002, mice given prostate cancer, given melatonin, and found that it decreases the EGF stimulation on the prostate cancer. So it stopped EGF from stimulating it. And they have done this particular research study in Hong Kong found that cancer cells can become resistant by getting rid of their melatonin receptor or downregulating the signaling system of melatonin as a way to become resistant. So, it doesn't seem to work forever. There's a way that cancer gets around melatonin as well. But at least at the beginning stages, it might be a useful thing, along with the soy, to affect EGF pathways. Okay, then there's another pathway. There's FGF. So as you get an idea of cancer likes a lot of things, not just testosterone. And you can measure some of these things and determine what is going on in a person's body and using some of these natural things to affect it. But FGF is another thing. Now, FGF, like EGF, I haven't seen studies where they measure that in the blood and it correlated with any prognoses. But they have measured the FGF receptors, finding that prostate cancer cells can upregulate those and other things that influence the prostate cancer FGF binding, something called fibrinogen. But basically what happens is prostate cancer cells are surrounded by these cells called the stroma. They surround it, and they make something called fibrinogen and fibrin. They are the components of a blood clot. And it's very common to see those elevated in men that are starting to become resistant to the hormone therapies. Those will be elevated in the blood, and they start surrounding the cancer. And then as the FGF is traveling by, the fibrin and the fibrinogen surrounding the cancer grabs a hold of the FGF and like a magnet and sucks it in. And so that maybe it's not that FGF increases in the blood or anything. It's just that the prostate cancer has a greater affinity for FGF because of the fibrinogen and fibrin. So you can measure fibrinogen and fibrin in the blood. So you can measure that and use that as a monitor that you're affecting indirectly the FGF system. And you can measure fibrin by measuring something called D-dimer. Well, I mentioned this last week. Boswellia is very good at lowering the fibrinogen level and might affect FGF. And there's an animal study done in Cancer Research 2009 showing that can decrease the growth of prostate cancer. In this one animal study, the cancer didn't really grow at all after 30 days of Boswellia treatment, but it increased by 5 times in the control group. And it does appear to affect that FGF and fibrinogen pathway. PGE2 is something that also upregulates FGF receptors on prostate cancer cells, allowing them to bind more FGF. And if you recall, if anybody listened to my breast cancer lectures, the PGE2 is a compound produced by fatty acid breakdown in a prostate cancer cell. So prostate cancer cells start to uptake something called omega-6 fats. So if you're eating a diet high in corn, like you're eating a lot of grain-fed meats and grain-fed dairy products and a lot of vegetable oils, then your prostate cancer will be full of omega-6 fat. The prostate cancer will then take that fat and turn it into something called PGE2, and then PGE2 helps it increase this FGF receptor. And then the FGF receptor helps bind the FGF. And so Numerous things lower PGE2. Borage oil, a seed from borage. Omega-3 fatty acids found in flax seeds and fish and hemp seed. All these have been studied. Borage oil has been studied to downregulate prostate cancer growth by affecting PGE2. Hemp seed has been shown to affect that as well. And I mentioned flax and fish. So eating a diet rich in omega-3 fatty acids and cutting out a lot of that omega-6 or reducing it. I mean, you need some omega-6, and you'll get it eating, hemp seeds and fish and everything. But you'll also get a lot of omega-3s. When you eat grain-fed products, you're getting hardly any omega-3 fatty acids, changing your ratios to a much higher level of omega-6, and then that can influence the growth. A last growth factor is the interleukin-6 pathway. Interleukin-6 is another food, should we say, for prostate cancer. It binds to a different receptor than FGF and EGF, but eventually leads to some growth. So it's just coming into that factory in a different way, different assembly line, but it ends up in the same pot stimulating growth of the prostate cancer. So you can measure interleukin-6 and things that are downstream from it. And there's been research in the British Journal of Cancer in 2007. Men that have higher levels of interleukin-6 are more likely to have hormone refractory or a castration-resistant prostate cancer. And so you want to do things that knock down interleukin-6. And then you can measure that in the blood to see that you're achieving an effect. And you can measure things that are downstream from the interleukin-6 pathway. There's something called MMP9, MMP2, something called UPA. All these things can be measured in the blood. And if they're elevated, they can lead to resistance, and you can use them as guides to tell that the natural things are helping. This is where the cruciferous vegetables come into play. There's been research showing that the more cruciferous vegetables that men eat, the less likely they were to get prostate cancer or have prostate cancer start to progress. Cruciferous vegetables include Brussels sprouts, kale, collard greens, broccoli, the sprouts from the broccoli seeds, all these things, and they've been shown to help reduce that interleukin-6 pathway. So you can start eating them, and you can, use these blood tests to measure that you're doing good. But the Brussels sprouts, the kale, and the collard greens are the best, especially closer to raw, where you don't cook them too much, over broccoli itself. So that's one thing that can be increased in the diet. And, good 4 servings if possible. And so that's like a cup of raw, but you put some in your smoothie, make a salad with it, you serve it on the side with your dinner, and it's pretty easy to get that much, and it's a great thing to add. There are some herbs that affect this. There's an herb called andrographis, which is an herb commonly used in India that has also been studied to help reduce the growth of castrate-resistant prostate cancer in animals, studied in the journal Genes in Cancer, 2010. It affects the interleukin-6 pathway. And there's an herb called plumbago. And that apigenin also affects that from the parsley. Eating the parsley containing the apigenin markedly reduces downstream pathways from the interleukin-6 pathway. Well, I hope you get a better idea of all the different things that can be combined besides, Lupron and Xtandi and Casodex and everything to keep that prostate cancer from progressing and becoming more resistant. More research needs to be done, but a lot of these things have not been shown to have side effects, well tolerated, and can start making changes to your diet. So this is Cancer Concepts and Compliments. I'm your host, Dr. James Belanger, and next week we're going to talk about blood vessel growth factor pathways.
Thank you for joining us this week. Cancer Concepts and Compliments with Dr. James Belanger can be heard live every Tuesday morning at 6 a.m. Pacific Time, 9 a.m. Eastern Time on the Voice America Health and Wellness Channel. We hope to see you next week for another show.